Good morning students. In today's video we are going to see about examination of the second cranial nerve. So second cranial nerve is optic nerve and we all know optic nerve is concerned with vision. So this will be the order. So we will be doing the test for near vision, test for distant vision, color vision, field of vision. There is one method to do the field of vision which we will be doing, and of course light reflexes have to be included, and accommodation reflex also comes under examination of second nerve. Many students used to forget to do light reflexes, but now they ask second nerve examination. So remember, light reflex, both direct as well as indirect light reflex, afferent is second nerve and efferent is oculomotor nerve. Whenever second cranial nerve examination is asked, see to that you do light reflexes also and accommodation reflex. Now I will start with near vision. This is the chart which is used for near vision. Jaeger's chart, Jaeger, Jaeger's chart is used for testing the near vision, which I am going to do. This most of you might have seen. This is Snellen's chart, Snellen, Snellen chart or Snellen's chart, which is used for checking distant vision. So this is Jaeger's chart for near vision and this is Snellen's chart for testing the distant vision or far vision, which I will be demonstrating quick. So to test the color vision, we use the chart, Ishihara's chart. It will be like a book and just it is marked with different colors, and we will ask the subject to trace the numbers, whatever it is written there. That is test for color vision. So field of vision, superior field, inferior, the subjects superior, inferior, medial, lateral, all those field of visions can be checked by confrontation test. So now let us go into the procedure. So as usual, before doing any test, just greet the subject and make him sure that you are not going to harm the subject. எப்படி இருக்கீங்க? ஸோ இன்றைக்கி வந்து நம்ம cranial nerve examination உங்களுக்கு பண்ண போகிறேன். ஸோ கண் பரிசோதனை நம்பர் தான், எதுவும் பயப்பட வேண்டாம், நார்மலாக தான் இருக்கும். So now I am going to do near vision. Yeah, near vision I will be using Jaeger's chart, and now the rules to be followed here is, please remember, each eye should be tested separately. For example, if I do like this, இதை படிங்க. Okay, so this is wrong because one eye may be normal, one eye may be abnormal, but he is able to read. So always see to that one eye should be closed. So now I am going to examine the near vision of his right eye. So left hand close பண்ணிக்கோங்க. Yeah, so he has now closed his left eye and I am going to check the near vision of the right eye, and the chart which I am using for near vision is Jaeger's chart, and if you carefully see, the numbers will be written in this. Yeah, N36, N24, and the below number is N6. What it means is, if Mr. Ranjit, if he is able to read only this letter, I am glad you took a choice on me, and is not able to see the remaining, means it is N36. Yeah, N36. So whichever words he is able to read, whatever number is shown there, that will be his near vision. If he is able to read everything, the below number is N6. Another thing, the distance, you can note it down, at which the subject should read is 25 centimeter. So that can be noted down. இந்த நம்ம இதை படிங்க. So okay, so Ranjit is able to read N36. படிங்க.
Particular heart, if there is the
Okay, so he is able to read N12. Now I am going to the bottom one. இதை படிங்க. Okay, தெரியுதுல்ல? Okay, so N6. So near vision, always see to that right, left. And Mr. Ranjit, near vision by using Jaeger's chart, right is N6. Now இந்த கண்ணை க்ளோஸ் பண்ணிக்கோங்க. என்னங்க அதே மாதிரி படிங்க.
I am ground.
Okay, so N36, the top one, is able to read.
Do not cover, keep me.
Okay, so கீழே இருக்கிறது தெரியுதுங்களா? மேலே. So left eye also N6. So for Mr. Ranjit, near vision, right eye it is N6, left eye it is N6, and the chart used is Jaeger's chart. Now in case if he is able to read only the top letter, he is able to read N36 but is not able to read N24, then what happens? N6 will be changed to N36. Near vision is over. Now coming to distant vision, very important demonstration in examination of optic nerve. Yeah, as I mentioned, the chart used is Snellen's chart, Snellen. Usually the chart will not be held, you might have seen, it will be kept fixed actually. Since I am doing a demo in this video, I am just holding it in my hand, but usually it will be fixed. Note it down, the distance at which we usually initially begin for him to read is 6 meters. You can note it down for Snellen's chart. 6 meter distance. Yeah, now I will explain about the Snellen chart, just concentrate. Yeah, A, what is written here? 60. Make Ranjit sit at a distance of 60 meter, you will be able to read A. That's what it means. Now see here 36 is written, XO. If I make Ranjit sit at a distance of 60 meters, Ranjit can read only A. If I make Ranjit sit at a distance of 36 meters, Ranjit can read A as well as XO. 24 means Ranjit will be able to read A, XO, TVH. But I can't make him sit in distance of 60 meters and check whether he is able to read A. So you just see here the bottom, what number is written? 6. That means at 6 meters you should be able to read this. Obviously everything, because when he is able to read this, which is the smallest letters, you will be able to read all the letters. The distance at which the subject is going to read the Snellen chart is 6 meter. Just please note it down. As usual, the rule is each eye should be tested separately. So now I am testing the distant vision of left eye. Imagine the distance is 6 meter.
A, X, O, T, V, H.
So like that you should be testing, and please note it down. In distant vision there is a term called visual acuity, small d by capital D. Snellen chart. So small d is always fixed, the distance of reading. So small d, note it down, visual acuity, which is the test for distant vision, and the chart used is Snellen chart. Small d by capital D. Small d is distance at which he is reading, which is 6 meter. Yeah, mostly we ask the subject to sit at distance of 6 meter. Capital D is the distance at which that should actually be read. For example, just concentrate. Yeah, I am testing the left eye.
A, X, O, T, V, H, U.
Okay, so this is 6, if you can see here 6. That means 6 meters. He is sitting at 6 meters, so he should be able to read. So here he is able to read all the letters. That means 6 by at which it should be read. So for Mr. Ranjit, I will do right eye, left eye. So this is distant vision. For distant vision, visual acuity. So left eye I examined 6 by 6. Now right eye will check. Yeah. So this is 6 meter.
A, X, O, T, V, H.
So he is able to read A, X, O, T, V, H. He is telling he is not able to read that U, I, X. That means what is written at 24. So numerator is the distance at which he is reading, which is 6, which is fixed, no doubt. Denominator is at which it should be read. It should be read at 24, but he is able to read only a distance of 6. Below it is not seen, so I can't put 18 or 12 or 6. So 6 by 24. Very simple. So visual acuity is small d by capital D. Small d is the distance at which he is reading, which is 6 meter. We are fixing it 6 meter. Capital D is the distance at which it should be read. Yeah, TVH should be read at 24, but he is able to read only at 6 meters. Below the numbers he is not able to read. So 6 by 6 is normal. That's what I want to say. Now you try to pause the video and try to answer this. He is able to read only A. That means very simple. It is 6 by 60. It is not max. Don't put 6 by 60, 1 by 10, 6 by 6, 1. This is just numerator is different, denominator is different. Numerator is 6 meters fixed. Denominator is whichever number is reading. If he is reading entire thing, 6 by 6, which is normal. Please note it down. Now comes next question. Always remember, both eyes should be tested separately. 6 meter distance. So even the first letter is not able to read. Then I can't put 6 is okay, but even I can't put 60 because A should be read at 60 meters. But at 6 meters he is telling he is not able to read the Snellen chart. He is not able to read A itself. Then what should I do? Now I will change the numerator. What I will do? I will bring it to 5 meters. So now what happens? I am changing the numerator 5 by padinga po. Ellame therudha lower letter. Okay. So now he is able to read even the letters which is the letter 6, number 6 is able to read. So that now what happens, it is becoming 5 by 6. Very simple. The subject will be moving to 5 meter. Snellen chart I can't move, but here I am just, since I am holding, I am making the distance come nearer, but the subject will be moving from 6 meter to 5 meter. Now the distance is 5 meter. So up to 18 is able to read. That means 5 by 18. So hope you understood how to calculate visual acuity. Small d by capital D. Very, very simple. Now next question. Now the distance is 5 meters. So even letter A is not able to see. Then 4. Again same thing. 4 by whatever letter is reading. 4 by 60 or 4 by 6. If it's not able to see, 3. So up to 1 meter. So up to 1 by, I can ask the subject to come. Now this will be fixed. 6, 5, 4, 3, 2, up to 1 meter. Now imagine, 1 meter. If he is able to read entire thing, what will be the visual acuity? 1 by 6. If he is able to read only A, 1 by 60. Correct, 1 by 60, 60. Now, next question. Now this is the distance of 1 meter. Snellen chart, I am making him sit at distance of 1 meter.
Not visible, sir.
So even at 1 is not able to read A, so I can't put 1 by 60. Now what I should do, I will go to next test. Please note it down. Finger counting test. இது எத்தனை சொல்லுங்க?
3, 4, 5.
In case if finger counting is not able to do, then I go for hand shaking test. நான் கை ஷேக் பண்ணுறது தெரியுதுங்களா? ஓகே இந்த கண். Okay, so hand shaking test I will do. If he is telling கையாட்டுறது தெரியுதுங்களா? Okay, so he is not able to find out the Snellen chart, even the top letter from 1 meter. Finger counting is not able to count the fingers correctly. Hand shaking is not able to do. Then I come for projection of light. Then finally perception of light. Even if he is not able to see hand shaking, then I go for projection of light test. Projection of light, that is, you should be able to tell from which direction the light is coming. ஒரு கண்ணை முடிக்குங்க. எந்த சைடுலேருந்து லைட் என்ன பாருங்கள், எந்த சைடுலேருந்து லைட் வருதுன்னு சொல்லணும். கை காமிங்க. ஓகே, லெஃப்ட் ஹேண்ட் சைடு. நேராக இருந்து வருது, மேலே இருந்து வருது. ஓகே, left side length. So he is able to tell from which direction the light is coming. That is called projection of light. In case he is not able to tell from which side light is coming, then I will go for perception of light. Light கண்ணடிக்கிறது தெரியுதுங்களா? Okay, so this is the final test, perception of light. So this is how we go for distant vision. So Snellen chart, 6 meter distance, normal is 6 by 6. Always see that you put right, left. So for him, actually for normal subject, right side 6 by 6, left side 6 by 6. So in case usually it will be 6 by 6, 6 by 6. And near vision N6, N6, Jaggers chart. It's not fixed at N6. If he is able to read only top letters in the Jaggers chart, it is N36. Okay, very, very simple. In case if he is wearing specs, then confusion whether I should test all these both eyes separately with specs or without specs. In case if he is wearing spec, then I have to put with the spectacles or with specs right left separately, then without specs right left separately. Note it down. Here vision is over, N6, N6. Distant vision for him, vision is normal, so it will be 6 by 6, 6 by 6, right, left. Now coming to color vision, you can see here is here a chart where color blindness can be even tested. Just it is color vision. So whether he is able to recognize red color, blue color, green color, all those things. Putting in a number 12. So he is telling 12, 1, 2. That is, you can see here. If he is not able to read, ask him to trace. So here you can see entire thing is green. This is orange. Since he is able to recognize green color, orange color, he is able to tell the number. In case if he is not able to read this, then the last side, the index page will be given. So every CRS chart contains index page. That will be mentioned. If he is not able to read this, he is having red color blindness. If he is not able to read this, he is having right color blindness. Again, ஒரு கண்ணு முடிக்குங்க.
35.
Okay, and the gun.
35.
Yeah, so he is able to read 35, but you can see the mix of color. Red color is there, orange color is there, black color is there, light green is there, but he is able to read 35 because his eye is able to differentiate all the colors. So he is able to perceive all the colors. So color vision is normal. Now coming to another important test, field of vision. The test which I am going to do is confrontation test, and the accurate field of vision testing is perimeter. I am going to do confrontation test. Now the test is very important. I am the examiner, he is the subject, 1 arm distance. Height should be same. For example, just imagine, and here in confrontation test, the examiner's field of vision is compared with subject field of vision. I am checking the subject field of vision. What here I am doing is, I am comparing my field of vision with his field of vision. So here one criteria, the examiner's vision should be normal. If I am having a defect in field of vision, I can't compare with him. Checking, and I can't do like this. என்ன மட்டும் பாருங்க. So is very below and I am very height, so it is not matching. So see to that first step. Yeah, sit at 1 arm distance. Okay, and as usual each eye should be tested separately. That is second rule. Third rule is both levels should be at the same height. So here better you can use that revolving stool. If one is short, make him little bit height, or the one who is height, make him little bit short. Here I think the height is okay. And now right eye close பண்ணிக்கோங்க. So now Mr. Ranjit has closed his right eye. I am going to check the field of vision of his left eye. Here what I should do is, I will be closing my left. His right, left here, same. Yeah, same. And one more thing, when you are closing, don't do like this. If I do like this, some fingers are coming like this, and so the field of vision may be little bit obstructed because I have to see, and this may obstruct. So see to that you straight. இப்படி இருக்காதீங்க, இப்படி. Correct. Now I am going to examine Ranjit field of vision in the left eye. So I am closing left, he is closing right. Very important. Same direction, that's all, same side. Another criteria இங்க பாருங்க, என்ன மட்டும் தான் பார்க்கணும். So please give this instruction. You should not see the finger moving. You should see the finger coming to his eye, and you should not use his eye to see the finger. உங்க கண்ணு வந்து பார்க்க கூடாது. என்ன பாருங்க, விரல பார்க்காதீங்க. விரல பார்க்க கூடாது. And the finger which I am going to use should be exactly the middle of me and Mr. Ranjit. I should not keep it here. Then you will be able to see, I will be able to see, like this. Now I am going to check lateral field of vision. His gaze should be fixed at me. என் கண்ணை மட்டுமே பாருங்க. Or tell him that he should see only my eye or my nose. Gaze should be here. எங்கேயும் பார்க்க கூடாது. என்ன மட்டும் பாருங்க. விரல் தெரிதா? Okay. So exactly where I am able to see the finger, he is also able to see. So lateral field of vision of his is normal with my field of vision. I already told my field of vision is normal. So I have checked lateral field of vision. The finger which I am using for field of vision should be exactly in middle between the two, between the examiner and the subject. So I am also able to see, he is also able to see. So this is inferior field of vision. So I finished lateral, inferior. Now I will go to superior field of vision. என்ன மட்டும் தான் பார்க்கணும். Yeah, I am also able to, actually you are doing it very correctly. He is exactly telling when I am able to see. And one more important thing, when you do field of vision, instead of doing like this, better to shake the finger and bring it, because usually when you are shaking the fingers, vision will be little bit clear. So that is told, instead of doing like this, I can do like this. So again I will demonstrate the superior field of vision. எப்போ தெரியுதா அப்போ சொல்லுங்க. Yeah, correct. Yeah, this is inferior field of vision. For medial field of vision, I will just change the hand, because when I do like this, it will be obstructing this. So I am doing like this. So this is medial field of vision. Kannu maathikonga. Yeah, now same thing I have to repeat for the other eye. So when medial field of vision, I will be changing the hand, but the sight is going to be same. So remember, for confrontation test, when he is closing his right eye, I will be closing the left eye. So when he is closing the right eye, left field of vision is checked. Maathikonga. When he is closing the left eye, right field of vision is checked. When he is closing his left, I will be closing the right. So I am telling him, he should not see the finger. When the finger comes to his side, he should raise the hand, or he should tell, I am able to see. Very simple. Yeah, field of vision, confrontation test, all the 4 field of visions. Here I cannot tell the degree, but in perimeter, the instrument which you use accurately measures the field of vision is perimeter, which I can tell the angle. But here just all the fields of vision are normal, superior, inferior, medial, lateral. Light reflexes is there. As I told in the beginning, light reflex afferent is optic nerve, efferent is oculomotor nerve. Light reflex, 2 types are there, direct light reflex, indirect light reflex. So direct, always when you are doing light reflex, we have to come from the side. This is wrong. So now I am doing the light reflex for direct light reflex for left eye. So come from the side. Yeah. So you have to look for the constriction of pupil. Now I am doing direct light reflex for left eye. Yeah. When light falls, the pupil constricts, which I am able to see. So direct light reflex I finished on right eye, left eye. Now, or I will do. Now I am going to check indirect light reflex, because bilateral fibers carrying is there. So indirect light reflex is, I will put the torch on the right eye and check the constriction of pupil of the opposite eye. So light I am putting on right eye and checking the people able to see people concern left eye. And always when you are doing light reflex, see to that you do it in a dim room. When the full light is there, that will disturb the normal light reflex pathway. So whenever you are going to do light reflex, see to that natural light or the very bright light should not be there. For second nerve, you have to do direct, indirect, then accommodation reflex. Accommodation reflex is, so ask the subject to see at a distant object. Yeah, very clear. So when you shifting from distant object to near object, there is convergence of the eyeball, constriction of the pupil, and convexity of the lens is increased. Very simple. I again repeat accommodation reflex. Accommodation reflex is asking the subject to shift from suddenly from distant object to near object. Yeah. So you can clearly see convergence of the eyeball, pupil constriction will be seen, and convexity of the lens is increased. So all these 3 will be seen in accommodation reflex, which I am able to see. So in today's video, we discussed in detail about optic nerve. Second cranial nerve is optic nerve. Near vision, Jaeger's chart N6, distant vision, Snellen's chart 6/6, 6/6, right eye, left eye. In case if he is wearing specs, you have to do both near vision as well as with specs, without specs. Then color vision, Ischiara's chart. Just he should be able to trace, or you should read that numbers, colored numbers. Apart from Ischiara's chart, we have Holmgren's color wool test. Nowadays we don't use that. Ischiara's chart, you remember. Field of vision, just now I did. In field of vision, both the examiner and the subject should be sitting at the same level, not height, same level. Adjust the revolving stool accordingly. When I close my left eye, you will be closing the right eye. So I will be checking his left field of vision. And I checked superior field of vision. In confrontation test, main thing is his eye should not move. My fingers will be moving, and when I move this finger, it will be exactly the center, and I will come from lateral, superior, inferior, temporal, nasal. So medial side is nasal, lateral side is temporal field of vision, and you should always see my eyes only. And when the finger comes, you should tell I am able to see. Light reflexes, just now we demonstrated direct light reflex, indirect light reflex. Indirect light reflex is also called as consensual light reflex and accommodation reflex. So all these reflexes, afferent is second nerve, efferent is third nerve. So this light reflex, accommodation reflex should be definitely done in examination of second nerve. So in today's video, we discussed in detail about how to examine the second cranial nerve. In next video, we will discuss in other practical session. Thank you for your patient listening. Hope this video was useful to you. So I would like you to share this video to our students community, because practicals is very important. And if you have not subscribed to our channel, subscribe to our channel, Physiology Lectures by Dr. K. Sindhil Kumar. We are making more and more videos for your convenience. If you want any topic of interest, or if you want any chapter to be taken, please you can put it in the comment box, so that I will try to make it in the upcoming videos. Thank you, and any doubts, be free to put it in the comment box. Thank you. We will see you in the next video.